Hi, my name is Alex Vignola, and this is the sterile field. We're going to start with our 7 steps, and then we are going to tape a garbage bag here to get rid of the old dressing. Place a chuck underneath the wound, just in case there's anything secreting from the wound. We are going to take the bandage off. Make sure you have clean gloves on. We're going to assess the wound, take the old dressing off, throw it away. We're going to notice any color, the discharge, smell, and we're going to know the depth for how many gauze we're going to need when we set up our field. Okay, once we've assessed the wound, we're going to set up our sterile field because you can't turn your back on the sterile field. So you're going to take off your clean gloves. And we are going to get our towel. No, first we sanitize before we put down the towel. Alright, our work area is sanitized. We're going to open up our towel. The white side is up. And we're going to maintain a 1-inch margin. So pretty much everything within the 1-inch margin is going to be sterile. Keep it in the 1-inch margin. Fill it up with what we're going to pack the wound with, and clean the wound. We assess the wound so we know how many gauze pads we're going to need. We're going to open it away from the sterile field, but we're going to dump over the sterile field. Tape. Now we're going to grab our gloves, open it up, place the package down, you're going to grab the lips on the package, open it up. Now everything on the outside of the glove is sterile. The cuff is what's going to be contaminated. So we're going to take it's going to go on our dominant hand first, so take your other hand, grab the inside of the glove, place your right hand on the inside, do not touch the outside of the glove, and just make sure you don't touch the outside. Alright, now with the sterile outside of the glove, keep your hands above waist. You're going to touch the outside of the glove, which is sterile. Take your left hand, put it inside the glove, and now with the sterile hand, you're only going to touch the outside of the glove. Alright, do not touch the packaging. One hand is going to be used for cleaning the wound. Dipping the hand. One's hand is going to dip, the other one's going to clean the wound. So, take a gauze, dip it in, pass it to your other hand, your dominant hand, and you're going to clean from the most infected area to the least, or from centered outward. And we're going to do this 3 times. Take the gauze pin, dip it in, pass it, wipe, clean the outside of the wound as well, throw away. Next hand, we're going to dip it, pass it, clean, throw it away. And now we are going to pack it. So we take another gauze, fold it up, dip it, and pass it, and place it in the wound. After that, we're going to take 2 gauze pads, place it over the wound. Make sure you're using the right hand. Alright, I ran out of gauze pads, so I'm going to take one out of the garbage, but don't do that. Pass it, place it over the wound, and we're going to take the final pad. We're going to place it over the wound, and now we tape it up. Beautiful. Alright, we're going to clean up our station. Clean up your station. We are going to reassess the patient, make sure they're okay. Make sure you sign and date when you change the wounds. Take off your gloves, make sure the area is clean, document, and that's Sterile Field.